Welcome to Healthcare Channel. Herpes is a viral infection caused by the herpes simplex virus, HSV. There are two types of HSV, namely HSV1 or HSV2 usually causes oral herpes, while HSV2 causes genital herpes. However, both types can cause either oral or genital herpes. The virus can also be passed on through skin-to-skin contact with an infected area, even if there are no visible symptoms. Symptoms of herpes can vary depending on the location of the infection. In oral herpes, symptoms typically include cold sores or fever blisters around the mouth, while genital herpes causes blisters or sores on or around the genitals, buttocks, or thighs. Both types of herpes can also cause flu-like symptoms such as fever, headache, and swollen lymph nodes. To diagnose herpes, a healthcare provider will typically perform a physical exam and ask about any symptoms. They may also take a sample from a blister or sore and send it to a laboratory for testing. Blood tests can also detect the presence of HSV antibodies. Herpes infection causes the virus to enter the nerve cells, where it remains inactive until reactivated. Reactivation can be triggered by factors such as stress, illness, or a weakened immune system. When the virus reactivates, it travels back down the nerve fibers to the skin, causing a new outbreak of blisters or sores. To prevent herpes transmission, it's important to practice safe sex and avoid close contact with an infected area during an outbreak. Using condoms and dental dams during sexual activity can also reduce the risk of transmission. It's also crucial to avoid sharing personal items like towels, razors, or lipstick. It's worth noting that herpes can have a significant impact on a person's emotional well-being and relationships. The stigma associated with the virus can lead to feelings of shame and isolation, which can make it challenging for people with herpes to seek support and talk openly about their experiences. However, it's essential to remember that herpes is a common condition, and millions of people worldwide live with it. If you have herpes, it's essential to take care of your physical and emotional health. Talk to your healthcare provider about treatment options, and reach out to support groups or counseling services if you need additional support. With proper management and self-care, it's possible to live a healthy and fulfilling life with herpes. Herpes is a viral infection caused by the herpes simplex virus, HSV. It can be transmitted through close contact, including sexual activity and sharing personal items. The symptoms of herpes can vary, but typically include blisters or sores around the mouth or genitals, as well as flu-like symptoms. It's important to remember that having herpes is not a reflection of one's moral character or worth as a person. Unfortunately, herpes is still stigmatized and misunderstood, leading to feelings of shame, embarrassment, and discrimination. It's crucial to educate oneself and others about the virus to combat the stigma and promote understanding and acceptance. It's also important to note that herpes can have serious health consequences for certain populations, such as pregnant women and people with weakened immune systems. Pregnant women with herpes can transmit the virus to their babies during delivery, which can lead to severe complications, including brain damage or even death. People with weakened immune systems, such as those with HIV or undergoing chemotherapy, are at a higher risk of developing severe herpes outbreaks or complications. Treatment. Antiviral medications can help manage symptoms and reduce the frequency and severity of outbreaks. These medications, such as acyclovir, valacyclovir, and famciclovir, work by preventing the virus from multiplying. They can be taken orally, applied topically, or injected in severe cases. Therefore, it's crucial to seek medical care if you suspect you have herpes, especially if you fall under these high-risk groups. Your healthcare provider can provide you with appropriate treatment options and guidance on managing your condition. In conclusion, herpes is a viral infection that affects millions of people worldwide. While it is not curable, there are effective treatments available to manage symptoms and reduce the risk of transmission. It's important to practice safe sex and good hygiene to prevent the spread of the virus and seek medical care if you suspect you have herpes. Additionally, it's crucial to combat the stigma and promote understanding and acceptance of people with herpes. With proper care and support, it's possible to live a healthy and fulfilling life with herpes. Thanks for watching. Subscribe now for more information.